What's going on, everyone? Happy Wednesday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I really hope you have a full and speedy recovery with no long COVID issues. It is time now for the Wednesday edition of the Pandemic Update for Wednesday, September 6th, 2023. We have a ton of news stories to get through today and some data to get through. We have to do some more Walgreens. I don't know how much we're going to get through that. Honestly, we may just skip most of the Walgreens this week simply because there's just so much news and data to get through. If we did all that on top of this, it would be over a 30-minute video, and trying to keep these to 20 minutes, though sometimes we do go over. Alrighty, starting off in Delaware, the first positive case of the new COVID-19 variant BA2.86 has been identified. We are starting to see this pop up in more states. We'll take a look at the B&O count for that in just a little bit. Now going up the I-95 corridor just a little ways to Philadelphia, to the University of Pennsylvania, where students are concerned by on-campus COVID-19 resurgence as Penn reiterates precautionary measures. So yes, COVID is rising at the University of Pennsylvania. I believe we're going to see another university setting report here in just a little bit. There's a lot of news stories up here. COVID-19 hospitalizations are on the rise in San Diego County. This is in California. Here's what you need to know. And yes, the county reported a 7-day average of 147 people hospitalized for COVID-19 last week, almost double what was reported in July. So there you have it, COVID-19 hospitalizations rising in San Diego. And to add, it does say it's the second highest number in the state of California, behind Los Angeles. So they're even higher than the Bay Area now. That's not good. Then we do come over to this. Here's some good news. Gotta add some good news in here somewhere. Moderna says updated COVID vaccine was effective against highly mutated BA2.86 variant in trials. So that is some good news, something we've been waiting to hear about. But then we come over to this. The WHO, the World Health Organization, sees concerning trends before winter as hospitalizations rise. The UN Health Agency says many countries stopped reporting COVID data and called for more vaccinations and surveillance. So they want more people to get the vaccine and boosters, and they want nations to start surveillance again. And, it is time. It's time we start taking this serious again. We're seeing things spill over into the hospitals. I mean, last year we saw some ways where, infections rose, but hospitalizations did not see a massive increase. They were already elevated, higher than what they are now, but they didn't see a massive increase. We're starting off from very low levels here, and we're quickly approaching levels that have not been seen since the middle of last winter, and it's still showing signs of rising. And I'll show you some hospitalization data in just a little bit for the United States, which, my friends, is not very good. All right, up to Michigan we go. COVID-19 outbreak at Maple Lawn. 3 patients at Maple Lawn Nursing Facility and 4 staff members tested positive for COVID-19 and are recovering, facility director told the board Tuesday. And this is coming after Michigan overall is seeing a rise in cases. The outbreak came as Michigan health officials reported Tuesday that statewide confirmed cases rose 14% to 2,528. All right, moving on to this. Colorado Lieutenant Governor Diane Primavera tested positive for COVID on Tuesday, September 5th of this year. She is currently 73 years old at the time of her case. I don't know if she has had a prior case. Didn't see anything about that. Now moving on to this. Students to wear masks again at Rosemary Hills Elementary School after positive COVID cases. According to a letter from Rosemary Hills Elementary School Principal Erwin Kennedy, 3 or more students in one class have tested positive for COVID. We're going to be seeing this in a lot of places. One thing I really hope we do not see is the parent-teacher, the school board meetings. I hope we don't see those embarrassing 2020 school board meetings where people are just sitting there yelling and then they're holding masks in hand saying, My child doesn't need to wear a diaper to get an education. Come on, cut the crap. It's a safety precaution. It's to keep the school from having to shut down. And yet people just do not understand that. All right, moving on to this now. COVID outbreak. This is actually a little bit of good news. COVID outbreak contained at Ohio Veterans Home. But let's read what the details of this were. Perkins Township. State leaders overseeing a locally based nursing home facility believe they've contained a COVID outbreak originating last week. On Friday at the Ohio Veterans Home, spokesman confirmed 15 residents/veterans along with 4 staff members tested positive for COVID-19. Most displayed mild symptoms, but several who have underlying medical conditions are more seriously impacted, said Jeff Rapp, spokesman with the Ohio Department of Veteran Services. And it goes on, visitors not allowed. But they feel they contained it at this time. We'll see. Maybe another story will pop up on this. I don't know. All right. Finally, now that's it for the news portion today. We kind of went through that a little quickly, didn't we? Um, this is the total number of BA 2.86 cases. The total is at 82, and the United States is now at 6 cases, with the United Kingdom really leading the way. There's now 36 cases in the United Kingdom. That's a little bit concerning. All right, we know that the top variant this week is EG.5 at 21.5%, FL1.5.1. FL151 is at 14.5%, and I'm still watching this HV.1, which is at 5.1%. Alrighty, heat-related illness. We have to refresh this because we know this could be relatively concerning. It's very hot in the Mid-Atlantic region right now. I'm looking at my weather station. It is currently 96 degrees here in Northeast Philadelphia, and the heat index is now 100 degrees. Wow, it is really boiling out there, and that's enough to cause heat-related illnesses. We're going to take a little bit of a look at that in just a few minutes because, yes, they are happening here in the Mid-Atlantic region. You can see here nationally, though, from the plains, the eastern portion of the plains, like right along the Mississippi River, you're seeing a lot of dark brown, and those dark browns are much higher than average calls for heat-related illnesses. You're still seeing increased calls in the southeast, and I suspect we're going to see this increase in the Mid-Atlantic before eventually dropping because it's going to cool down a little bit in the Mid-Atlantic. And now we do have to take a look at air qualities. This needs to be refreshed. When it's not looked at in a while, it just goes gray. And you can see, yeah, there are some concerned air qualities from the Carolinas all the way up into the Northeast. You're seeing some oranges pop up, some numbers over 100. Then we have some really concerning numbers ongoing in the plains at this time. And get that off the screen. We don't need this on the screen. You can see, look at the plains. Wow, a lot of red showing up. So that, my friends, is not good. That's unhealthy air qualities. Limit your time outdoors during those periods. Better now on the West Coast, but you do see an isolated place, a few places that are still experiencing some bad air qualities, and Canada continues to be at bad air qualities as well. If you want to learn more about climate, air qualities, and all that sorts of stuff, I do have a channel where I just do that. It's called Climate Data Report, and we're going to be talking about Tropical Storm Lee. It's something that we are watching. It's going to become a major hurricane. The question is, does it pose a threat to the United States? It's something we'll have to watch. I would especially pay attention if you're in New England on up to Canada. Pay attention to it. It could become a threat for you. So I do have a channel, another YouTube channel for that. I also do have Climate Data Report, which is another Twitter that I run as well, where I do tweet climate-related stuff, not just tropical, anything climate-related all around the world. All right, let's get to some Walgreens numbers. We did the East Coast yesterday. I think we did a couple on the West Coast. We're just randomly going to do a few today. We're not going to do that many because we still have a lot of data to get through. So let's take a look at some important states. And here is Illinois. Illinois was 40.5% this week, 43.1% last week. That's a difference of down 2.6%. Total test, 269. The prior week was 267. Taking a look at Indiana. Yikes, this is not good. Indiana, 40.6% positivity this week. Prior week was 30.5%. That's a difference of up 10.1%, and testing is up as well. 96 versus 82. Ohio, 49.2% positivity this week. 42.3% last week. That's a difference of up 6.9%. Total tests, 63 versus 52. Let's come up here to Minnesota. 34.4% positivity this week, 28.6% last week. That's a difference of up 5.9%. And yes, testing's up as well. This is a legitimate rise, 61 versus 49. Wisconsin this week, 35.2% positivity this week, 37.5% last week. Difference of down 2.3%. Testing's down by 1, 71 versus 72. That's a legitimate drop. Michigan, 29.1% positivity this week, 36.4% last week. Difference of down 7.3%, 55 tests versus 55. So, yes, I guess you could say this is a legitimate drop. Let's come down here to Texas. 42.1% positivity this week. Prior week, 46.3%. Difference of down 4.2%. Total tests, 2,149. The prior week was 1,642. And we're just going to do two more states here. Colorado, 34% positivity this week. The prior week was 29.2%. Difference of up 4.8%. 94 tests versus 65. This, my friends, is a big increase. And then we come down now to Arkansas. 44.2% positivity this week. 37.9% last week. That's a difference of up 6.3%, and big increase in testing, 43 versus 29. So this is a legitimate rise. We may do some more states tomorrow. We'll just have to see how much news and data there is. It's a really busy time right now during this wave. And speaking of this wave, yes, there was a correction to BioBot. So remember, BioBot had the South dropping? Take a look now. South isn't dropping no more. South is continuing to rise. Here's the last 6 weeks. I can also show you the last 6 months. Look at this. I mean, this is just a rapid rise. The Northeast was adjusted to rising faster. The West Coast is still rising. The Midwest is still rising. This is just concerning trends in wastewater at this time. I mean, it's not good. I mean, it's continuing to go up. Let's take a look at the national wastewater here. And then we will do a couple of those wastewater scan sites. We have to include some flu numbers as well. I mean, look at all these orange and red sites. This is ridiculous. I'm going to shift myself to the left for a little bit here. And you can see here, it's just really rising. It's happening in the Northeast, the Southeast, the South Central, the Great Lakes, the West. It's rising in all regions of the United States. And we're on pace right now. I mean, we're only in September, my friends. We're on pace right now to see potentially a higher peak this winter for all metrics than we did last winter. I'm going to go out there on a limb and say, you know what, it's possible unless something changes, because it's September and these levels are really rising. I'll show you more proof of that in just a moment. Let's take a look at, I don't know. How about we come up here to Chicago? Let's just go just west of Chicago. Coronavirus is rising. Influenza, flat. RSV has dropped. There was some RSV in August. HMPV, not there. Mpox, not an issue. Norovirus is dropping at this time. And let's show you California, shall we? Let's go back out here to California. We talked about San Diego. Can we go down near San Diego? Well, yes, we can. By golly, we can. So COVID on this most recent update has actually dropped a little bit. But the overall trajectory has been up. But again, that's actually a pretty big drop. Influenza is not yet rising. RSV not an issue. HMPV not an issue. Mpox not an issue. And norovirus is dropping at this time. Now we go to this tweet from BNO News. Remember how I said I'm concerned at how fast we're rising? People keep saying, oh, well, we're lower than this time last year. Okay, last year at this time, hospitalizations were just over 20,000, right? Close to between 20 and 25,000. You can see that here in the center of this image. Look where they are now. They're quickly heading for 20,000. If this keeps going for several more weeks, guess what's actually going to happen? And there's some nitwit in here says, here's what the whole chart looks like. Okay, I don't need to see the whole chart. I see what they looked like last winter. All I care is, We're quickly rising. And you see here, look at this. The overall average, it's a rapid rise. We're going to hit the levels of last September relatively soon. Will they eventually peak and drop a little bit? Sure. But look what happened last year during the holidays. They rose again, and honestly, I don't know what variant will be on in the holidays. The point is, they're continuing to rise. They're going to pretty soon come close to where they were last September, and that is relatively concerning. Here's more data on the hospitalizations. COVID-19 hospital admissions the past week, 17,418. Weekly percent of emergency department visits for COVID, 2.3%. Hospitalizations rose nearly 20% in 1 week. Already continuing on here, Philadelphia had 863 EMS incidents yesterday. Remember, they had that tweet where they said that there was hundreds of EMS incidents by 9:30 in the morning, and part of this is not only because of COVID. Like I mentioned to you, heat-related illnesses. It's very hot here. It is now 97 degrees here, so yeah, it is very hot outside. Here's what's going on in Montgomery County, which is just outside of Philadelphia. It was at 20 incidents earlier, slightly down now. I'm seeing stroke. Earlier, I was seeing heat-related illnesses listed on here. So yes, the heat is definitely causing an increase in calls in this particular area. You can see Chester County is very busy now as well. Then we come to New Jersey. New Jersey has 426 COVID hospitalizations now. 28 people on a ventilator. Yeah, that hospitalization number, it was corrected higher. Remember, it was a holiday weekend. 51 people in the ICU now. That's not good. That's actually not a good ratio. 426 people in the hospital, 51 of them in the ICU. ICUs, they're rising. Let's take a look at that chart, shall we? Yeah, ICUs, they're starting to rise now. And remember other years, they would use the excuse in the news saying, well, it's in the hospital, but we're not really seeing ICUs rising. No, this wave now, this year, unlike last year, the ICUs are rising. That's relatively concerning, my friends, and this is with 69 out of 70 hospitals reporting. And then we come over to New York State, 1,805 new cases, which includes reinfections now, but it does not include those at-home tests. And then we come over to this, and this is really bad. So yesterday we told you there was 1,157 people in the hospital in New York State, 109 people in the ICU. Let's fast forward to today. 1,391 people in the hospital. And let's do some math here. So if we take 1,391 and subtract that from yesterday's total, which was 1,157, that gives you a total increase in just from yesterday's update. That gives you a total increase to 234. So that, my friends, is a big rise, and a big part of that is, take a look at emissions here. And you know what? We can leave this on the live wide view range. Some people like to say, well, here's what it was other years. Okay, I'm going to do that for you. Look at this. Yeah, then there's today. That is a big rise. Now let's zoom in so you can see that a little bit better. And take a look at that. Yeah, that's like rocket shipping now. It's literally almost going straight up. Here's the emissions. This is what I want to show you. Check that out. That is just a humongous increase. On the start last week, 539 emissions. To start this week, now part of the reason why it's a rise so big in emissions is because it's gone bigger spacing in between updates, but still, 809 new emissions. That's just crazy, isn't it? And then we move on to this. Texas did update today. Current week's cases, 30,196, which is 3,001 higher than last week's 27,195. Total fatalities, they increased again this week. 42 versus 39, that's up by 3. Hospitalizations were up by 189. They rose to 1,427, so they did have a big increase. Alrighty, do we have any other states today? I don't think so. We will have more states again tomorrow. Moving myself back to the right now. Now we can take a look at a little bit of an international update. We'll just do a few different countries. We're not going to do too many here. You can see, taking a look at South Korea, cases down 63%. Deaths are down 19%. Brazil, cases down 8%. Russia, cases are now up 98%. Hospitalizations are up 45%. Belgium, cases up 44%. Israel, cases are up 32%. And deaths have doubled, 10 versus 5. Mako, cases up 11%. Hong Kong, cases up 40%. And we'll end today on Poland, where cases are up 33% and deaths 2 versus 1, so that doubled. Alrighty, folks, that does it for today's pandemic update. We threw a lot of news and data at you today. You can just see how bad things are getting right now. We'll have another pandemic update again tomorrow. We'll do this all over again tomorrow. I'm sure there'll be more news stories to share. Until I see you again next time, if you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs to see updates like this, by all means, share this with them. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Wednesday evening.